So RSV, or respiratory syncytial virus, is a common respiratory virus that comes every year. Sometimes some years are worse than others.
RSV is extremely contagious. It can survive on surfaces for several hours, so it spreads very nicely around daycares and nurseries.
And it's really harmful to young children, particularly because it causes bronchiolitis, and it makes it so that they can't breathe well and they can't feed well, and they often end up in the hospital. In 2023, there was an immunization that came available for RSV prevention. And availability of that drug was a little bit light in the 2023 year, but in the 24 and 25 respiratory season, and then again in this year, we had good availability of that immunization. And so we have been able to really give that to many, many children in their first year of life, and have been able to prevent a lot of RSV, and hospitalizations have been very different.
This time of year, normally we would be drowning and inundated with respiratory admissions related to RSV infections in babies. But this year, as well as last year, we've seen a marked decrease in that burden of disease on our system.
There is an immunization that a pregnant mother can get in her last trimester of pregnancy, and then her body will make immunity to RSV and pass that on to the baby before the baby is born. Then babies who were born without that protection, during that well newborn visit, we have been able to give them immunizations. In the kids that did not get this immunization, 1 in 48 are hospitalized. If they did get that prevention, 1 in 400 are hospitalized.
Preliminary estimates put it in the ballpark of between a third and a 50% reduction in hospitalizations for infants in our state, which if you take a typical season where we may be admitting a couple thousand patients, if you cut that in half, you can imagine the relief that would put on a system.
If they were not immunized, 1 in 200 end up in the ICU. If they were immunized, 1 in 1,000 ended up in the ICU. And when you think about that from a family's perspective, that's a family that gets to keep their baby, have them well at home, and talk about the expense for a family as well. That really helps them with not having that healthcare expense for a hospitalization. If you haven't gotten it and you're at home and you have an infant that is in their first year of life, reach out to your pediatrician and ask them to get that shot.